Good morning. You know, as I've listened to the appeals this morning, I think of those in other countries. It's very difficult to imagine that unless you're there. And we can look at it from a distance, but until you've actually been there, it's hard to understand. So my topic seems a bit trite compared to what we've heard already this morning. But I'd like to share with you the significance of what we do and why we do it. I used to spend a lot of my lectures trying to encourage people that if they would change their lifestyle, they get to live longer. And that if you do this, and we study the Adventist study, and we say that Adventists live difference between 7 or 11 years longer. But I've come to the conclusion that it doesn't matter whether you live 7 or 11 years longer if you're just becoming a better sinner. You can really miss the whole point. And so now what I talk about is not about living 7 or 11 years longer. I don't even know if we have 7 years on this planet, let alone longer. But what I'm encouraged about is that you and I have the most critical decisions before us that you ever face in your lifetime. And on those decisions depend where you will spend eternity. So what I have to offer you this morning is a methodology for clearing your mind so that you can make those decisions, so that you can make those commitments, so you can clarify what your goals are and your purposes and what in the world are you doing here. Because if you haven't got that straightened out, the whole world around you will tell you what to do, and it usually is bad information. So I've turned from talking about longevity to taking care of your mind, because that's where the decisions are made. And the strongest thing that affects your mind is what you put in your mouth. It may seem very simple, may seem very trite. So we've spent the first 2 lectures talking about what you put in your mouth. This lecture we're going to talk about what you do for your brain. Because the best way to drive a person totally insane is to totally sleep deprive them for 72 to 120 hours. This is probably one of the oldest techniques to drive a man or a woman insane, is to deprive them of sleep, make them stand in a standing position, they can't move, and they would do whatever they can to keep you awake. And in a matter of days, you'll be doing good to figure out what your name is. The funny thing is that most of us aren't in concentration camps. We're not standing without food or very little water. We do this all to ourselves. Can you believe it? We are actually choosing insanity with our minds on a regular basis. Well, how do we do that? Sleep deprived is a situation where most of us don't admit that we are what we really are. The part of the problem we need is we have the problem. The general findings that nearly 2/3 of Americans experience sleep problems. And the medications that deal with sleep, like Ambien, are passed out like water from your doctor's office, between that and tranquilizers, and people use them as though they're supposed to need something, when they don't admit that if you have to take a drug, you're sick. See, taking drugs anymore, the doctor would tell you if you take this drug, it'll improve your health. Or now we even have drugs you take to prevent something. We give you statin drugs to prevent heart disease. I'm saying, excuse me, drugs are for sick people. You remember Fat Albert, don't you? What was his song? Drugs are for dummies. Dummies take drugs. Well, I'd like to encourage you to think about what Fat Albert said, because he's still correct. The problem is you and I have been brainwashed enough to think that now taking a drug doesn't mean you're sick. I take history saying, what's wrong? They go, I'm healthy. Well, how's your blood pressure? My blood pressure is good. And I keep going there. I go, what medications are you on? Well, I take a blood pressure medication. I'm going, you're not healthy. You're sick. If you take drugs, you're sick. So therefore, what are we going to do to get away from that? Sleep deprivation, same thing. If you don't take the opportunity to sleep, then you're going to take a drug to try to make up for it sooner or later. 43% of adults say they are sleepy during the day, that interferes with their daily activities. If you have lost someone, a family member, that drove off the road at midnight and killed himself in a car, this gets really close to home. You know, we lose most doctors, not just disease, we lose most doctors, guess where? In airplane accidents. Where do we lose most ministers? In vehicle accidents. Sleep deprivation is not something that's exempt from any class. More statistics. 50% of the people over age 65 years of age suffer from some type of sleep disorder. 50% of so-called, I want to emphasize that, so-called hyperactive children do not need Ritalin, they need BED. That stands for bed. Because we allow a child to choose when they go to sleep, and we think that they're an adult, so they get to pick when they go to sleep, when the child needs it. Tell you what we did in our household. My children went to bed at 7 o'clock. My daughter said, "Dad, when do I get to pick my own bedtime?" I said, "When you're 18. And when she was 18, she picked her own bedtime. She stays up too late. My son, on the other hand, when he picked his bedtime, it didn't change from when he was 17 days or 17 years and 364 days when he turned 18. 50% of all hyperactive children have underlying sleep disorders which are treatable if diagnosed early. The treatable is go to bed. Sleepiness in the workplace. 1/2 of American workforce, 51%, reports that sleepiness on the job interferes with the amount of work they have done. 40% of adults admit the quality of their work suffers when they're sleepy. We have a sleep-deprived culture. Changes that are affected, physical changes, fine hand tremors. How are you doing this morning? How'd you sleep last night? I had the best opportunity I've had in a long time. Most of the time I lecture, then get in the vehicle and drive for hours. I got to leave here, walk out that door, walk around that corner, walk that corner, and there's my motorhome. So I didn't even mind staying a little bit late last night. I'm sorry for you if you didn't get all your sleep in. Difficulty focusing your eyes. How many times do you go to the eye doctor and he says, you don't need a new prescription? You go, but doc, I can't see. How about increased sensitivity to pain? Do not go to the dentist in the afternoon. It hurts worse. Go to the dentist in the morning. There are certain pain circadian rhythms in your body, but they are also increased due to sleep deprivation. Decreased muscle tone and strength. A lot of people have poor posture because they're sleep deprived, and that goes right here. Decreased ability to maintain normal posture. And so now most people stand up, pull their shoulders back. Decrease in body temperature. A decrease in body temperature can mean a number of things. It can mean you're starving. It can mean your blood sugar is too low. It can mean you have a thyroid problem. Now here's my challenge for many of us. Because one of the most popular medications in the United States is Synthroid or levothyroxine, where you take the generic or you take the real one, and guess what? Most people don't need it if they go to bed. I see so many thyroid patients on that medication that definitely don't need it if they would go to bed and get rid of some of their stress, because they confuse thyroid problems with adrenal fatigue. And their adrenaline has been pumped so many years for so long, we call these people adrenaline junkies. They don't need drugs. They've got a way of staying up till midnight and getting up at 4 o'clock in the morning, and they drive and drive and drive and push themselves. They made it through college that way. They made it through the career that way. And I see them at 48 years old, a really mental wreck. And I find them, they come and see me, they're on antidepressants, they're on sleeping medication, and they really don't like where they're at. And it's not because they're not successful and financially well off, they just don't like who they are anymore. And G, feeling washed out, depleted, low energy levels. Causes of fatigue, you've got your own list. A few may be long hours of work, lack of sleep, obviously, academic pressures, sales goals. Why do you think they call things deadlines? There is a reason we label things this way. Rotating shift work has been a major curse in our country. I mean, when God turns the lights out, why don't we catch on? This thing we call electricity may be one of our biggest dilemmas. How many of you have lived in an Amish community for any period of time? Anybody have that experience? Or how many of you have been in a situation where the electricity goes off for a few days? The first day, you go in the room and you keep flipping switches, right? The next day you go, well, I guess I don't need to flip that switch. And by the third day you're without power, you go, this isn't too bad. I sleep in, I wake up, I feel great. When the light's up, I get something done. When the lights go out, I go to bed with the chickens. Well, see, the way God made man is very interesting. We are just coming now from the winter months that you have longer days, longer nights, longer dark cycle, so to speak, compared to light cycle. We're switching that at this point in time. Well, why do you think God made a dark cycle longer in the wintertime and a light cycle longer in the summertime? Hey, it's the way you're made. It's the farming mentality. Go to the ant, thou sluggard, learn of her ways and be wise. Work when you've got light and go to bed when it's dark. And if you work in the summertime, prepare your food. Then in the wintertime, what do? Oh, we turn on the lights. We work midnight till we work 12 to 12-hour shifts and keep on going. We're not thinking very clearly. Causes of fatigue, irregular schedules, use of stimulants, coffee, tea, and amphetamines make you more tired, not less tired. Do not be fooled by that cup of coffee in front of you. Dehydration, television, one of the major causes of fatigue. When you watch television, it suppresses your metabolism. Let me say it this way. You can stare at a wall and have a higher metabolic rate than staring at a television. Television actually suppresses your metabolic rate lower than doing nothing. So when you eat and watch television, you've got the best combination for putting on pounds if that's your goal. Pursuit of leisure time, compress the work week, fly somewhere. You know, it's the kind you have to come home from vacation to rest up. One of those kind of vacations. Quest for more capital, sports injuries, late evening meals. Consequences of fatigue, slowed reaction times. It's called auto accidents. New York State, part of their history when they question you about why you just got in that auto accident is how many hours have you slept for the last 3 nights? Guess what you find out? Many auto accidents, unfortunately, many deaths are right here. You see single car accidents, you see the guardrails all torn up. I spend a lot of time on the road. I'm going, why'd that person drive off the road? Well, they may have been holding their cell phone. But the point is that single car accidents, just all torn up, usually the person is drowsing. Well, let me ask you a personal question. How many of you use the vibrator bumps along the road on a regular basis? Well, they're there to use, aren't they? Slowed reaction times. In driver's training, they still offer driver's training in school? Yes, they do. I've seen cars out. That's the reaction time from the gas pedal to the brake. How fast can you go? And when the mind is fresh and alert, you can do it in a fraction of a second, even less than 1 second. Not anymore. Reduce mental efficiency. This deals with workplace environment. Self-paced versus work-paced. Self-paced would be your janitor to come here and clean the church. If you come here on Sunday morning or Monday morning and you haven't slept all Sunday night and you come here Monday morning and it takes you a half hour or even 45 minutes along to clean the church, but you only get the fee for turning, you only get $40 for cleaning the church anyway, and you do it and take an hour longer, who's going to care? Not a big deal. And you're not going to suffer because it is what we call a self-paced occupation. It's not a hazard. If you take a little longer, you just have a little bit less time of your day. Now, a work-paced environment is totally different. A work-paced environment is like driving down the road. At 60 miles an hour, you're driving 88 feet per second, you better be awake, because your eye cannot see things at 88. We are able to go fast enough now that the brain can't keep up with it. What if you're an airplane pilot at 600 miles an hour? Or what if you're a fighter pilot at 1,300 miles an hour? It gets a lot more critical. And we're going to show you some studies on pilots and what happens. And you better pray for your pilot when you're in that plane the next time you fly. I highly recommend it. I hope he's not sleep deprived. So work-paced, assembly line work. There's so many widget-gidgets that come down the line, and you're supposed to inspect them all in a period of time. That's why we say, I sure hope it wasn't made on Monday. We hope we get one that's made on Wednesday or Thursday, because by the time it's made on Friday, they're ready to go home, and Monday they're sleep deprived, and so you wind up wanting to figure out why it broke. Another function of the brain is very interesting. Your brain samples material, or your brain samples input on a regular basis. That's just down here. Input filtered, some dumped. I know it doesn't sound very medical, but it's still a good word. As you're driving down the road, when you're tired, why do you weave so much? You may even stay between the lines, but you're weaving down the road and you correct and come back and come back. See, when your brain is more alive and more active and well rested, your sampling rate of input material may be 100 times a second. Now, if I had a very specific camera on you, we all weave all the time. But when your brain is rested, the weaving may be so minor that you can't even detect it. But if I watched your hands and I watched the car on the road, I would see that. The more tired you get, the brain can't process at 1,000 a second. It may be down to 10 input per second. And so now you can go this far in the lane before you correct and come back. And so when you see a person going down a lane like this, well, they may be intoxicated. When you see a person going down the lane, it can be sleep deprivation. And sleep deprivation is very close to intoxication for those that you probably would never think of drinking. In fact, who would you rather meet on the road? The person who's intoxicated or the person who's dead asleep? I'm not sure, especially if they're coming right for you. But the point is that they're very close to the same. So, input is filtered and some dumped. Depending on the fatigue level of the brain, your sampling, the size of your sample or how many samples you take per second gets larger and larger. So I tease a lot of people. I live in the mountains of North Carolina. It is absolutely beautiful. And many people move to that and live on top of these mountains and build these houses on these top of these mountains for what? For their $1 million view. And then they get a job to try to pay for this extravagant house that they have. And they leave the home before it's light and come home when it's dark and drive like crazy in between. And I'm going, what are you doing? You moved here to enjoy it. And what you've done is you're so sleep deprived, you can't even enjoy the surroundings. By the way, Virginia is beautiful too. I just never lived in this part. I lived in Richmond and went to school at VCU and lived out in the Tidewater area, but I do appreciate your state. Inability to process new information. The tired brain cannot perceive things correctly. Impaired long-term memory. Long-term memory is usually what doesn't get impaired. Usually it's short-term memory, but impaired long-term memory due to sleep deprivation, you can't recall things, especially people's names. Have you had that trouble yet? Or you sit there and you try to remember, oh, you know that fruit, you know, it's red and it's got a skin on it and grows on a tree. Oh, you mean an apple? Yeah. Well, how many of you should forget what an apple is? I mean, you know, that's long-term memory. Less awareness of surroundings, we've talked about that. Number 6, increased irritability and hostility. I don't have a rate for you, but I do know that certain professions have a much higher divorce rate. Airplane pilots have a very high divorce rate. Why do you think? Flying a plane is not overly taxing if you're awake. I mean, you know. Sleep deprivation, increased irritability and hostility. How many marriages could be saved if people would go to bed? I don't mean it that way. I'm talking about getting their sleep. So the point I'm getting at is a lot of times simple things make big difference. If you're not rested, you're not fun to be around. And if you or your spouse is a big crank, then maybe you should give a hint. Like maybe go to bed. Increased risk of sleep disorders. Sleep disorders wasn't even around when I was in school. Yes, I believe some people had sleep apnea, but sleep disorders has just escalated rapidly in the past 30 years. More on sleep. Men who slept only 4 hours a night ate 22% more calories. Do you wonder why we're getting bigger? Maybe we're trying to eat, trying to get energy. Maybe we're tired. Maybe we're worn out. They ate 22% the next day than they did after an 8-hour sleep. So if I can eat 22% less calories by sleeping, I've got a great weight control program going here. Also, studies also found that a single night with only 4 hours of sleep this is really important, led to insulin resistance in 75% of the men and women in their 40s. Now, if you have insulin resistance, that means that this sleep deprivation turned you into a diabetic for the next day. But you say, I'm not a diabetic. I said, you are a diabetic functionally because of the insulin resistance. They're less able to move blood sugar into their cells. Obviously, that's insulin resistant. The body produces the same amount of insulin, but the insulin isn't able to do its job. So can you believe that sleep affects your blood sugar levels? Insulin resistance can lead to heart disease, diabetes, and breast cancer. Dr. Jordan out of State College there at the University of Pennsylvania looked at this. In a weight control program, here's what he found. Those who participate in a weight control program snack less during their evening meal preparation if they have a little 10-minute nap. You know what you need? You don't need a snack, you need sleep. Please diagnose yourself correctly. If you don't diagnose yourself correctly, you will eat and then you will be sleep deprived more. Eating and sleeping, or the sleep of after you eat a large meal, is not healthy quality sleep. Why is that? You made your intestines work all night. I mean, you can't get good energy if you're working. Sleep and insulin resistance. This is hours of sleep, 4.5 hours and 8.5 hours. Insulin concentration at the bloodstream. Notice that the group that has 4.5 hours of sleep, and by the way, these are not diabetics. This is from the Annals of Internal Medicine. Those who sleep 4.5 hours of night had almost 3 times the insulin requirement that the group that slept 8.5 hours. Now, if you keep having this high of a, so to speak, this much sleep, and you're losing your sleep and requiring almost 3 times the amount of insulin, what's going to happen to your pancreas after 10 years of working a night shift or 20 years of a night shift? Medicine has been very guilty, and we've gotten more guilty. You know, we went from 3 shifts, you're 7 to 3, you're 3 to 11, and why do you think we call it the 11 to 7 graveyard? Who's it killing off? The patient or the participant or the nurses? Now we've done it really bad. We said, okay, that was bad, but now we're going to make it worse. We want you to work 7 to 7 and 7 to 7. You go, what are they going to call that shift? Suicide? I don't know. And yet, what you find out is you work those shifts and you go, but I have more time off now because I can do this. I'm going, how do you spend your time? Tired, worn out, angry, hostile, a pain to live with, and you're not happy either. Microsleeps. This concept of a microsleep really attracted my attention. Of course, we're talking about a driver here in Florida. In January 2006, a truck driver plowed into a car near Lake Butler, Florida, killing 7 children in a fiery crash. I said, I'm very sorry, but unfortunately, it probably is due to a sleep-deprived situation. But a microsleep, by definition, means you're sleeping from a second up to 10, 15, maybe even up to a minute. So a microsleep is not a person that's gone out and they're snoring for you, okay? A microsleep is a brain function in a very sleep-deprived brain, and you can be driving down the road, and the person can be sitting next to you, they can look at you, your eyes are open, you can actually look like you're driving, and you are dead asleep. You're hypnotized by the road. We call it being on autopilot. It's hypnotized, okay? Just admit it, you're out. And it can last from a very short period of time to obviously a long period of time. What if you had to make a critical decision and you're going 88 feet per second, 3 seconds out can put you right through the car in front of you with no problem? So Volvo comes out with this special system that will not let you get too close to the person in front of you. Do you realize how much we spend on sleep deprivation indirectly? We have vibrator bumps. How much does it take to put vibrator bumps up and down the middle of roads and on the side of the road across the United States? What do you think the price tag is for that? We could afford to buy everybody a new mattress, don't you think? I mean, why don't we just tell people, go to bed? Sleep is not a crime. When God turned the lights out, let Him take responsibility for you being so efficient. And if you think you're so efficient, how do you think efficient God is? I'm glad He made oxygen this morning. I hope you are too. I'm breathing pretty good. I'm glad my heart's still ticking. See, what we think and what we do sometimes is totally against God's plan. And when God turns the lights out, we all start saying, hey, maybe it's okay to go to sleep. Maybe I don't have to finish that extra project. Maybe that project won't make a hill bit of difference. And when you hear those people that are being chased by ISIS right now, you realize that my life is extremely cushy, and I've got a pillow, and I had clean sheets, hopefully. You go through the whole list and you go, wow, what is the most valuable thing to you in life? Dr. Belinkie, a research scientist, a medical doctor for the research scientists dealing with the military cause of friendly fire. How many of you know what friendly fire is? We call it that, unfortunately. It still kills people. But unfortunately, it means our own troops get in the way of our own troops. It could be an airplane crash. It could be a helicopter down. It could be a bullet. But you remember, many of our troops are functioning in a very sleep-deprived issue. Very little sleep. In fact, they're trained this way. Any of your special forces are trained in sleep deprivation maneuvers. The Army Rangers are trained to do with very little sleep and then interrupted sleep. And if they average 4 hours a night, that's good, and that's interrupted. It's hard to think clearly with that much sleep deprivation. So Dr. Belinkie said, okay, what is happening? What part of the mind is being affected? Why are we losing men? What is the cause? And of course, his cause was sleep deprivation, fatigue. So here's what he got. This is cerebral metabolic rate. That's your brain. How fast is it metabolizing energy, food, whatever? So we used glucose to figure out how much your brain is using. And by the way, your brain runs on sugar. You have to have glucose. Even diabetics have to have glucose for the brain. That's the only organ in the body that totally depends on glucose. Every other organ in the body, every other tissue in the body can run on different fuels. The brain has to have glucose. This is why blood sugar levels are so affecting your brain level. Your leg muscle can do just fine when the blood sugar is low. Your brain can. So what he did was he said, okay, down here, sleep deprivation, 8, 16, 24, 32, up to 80 hours. What happens? And the metabolic rate, your cerebral metabolism, your cerebral metabolic rate. So we start up here. This doesn't look like a major change for you, but this brain is consuming almost 5.5 milligrams per minute per 1,000 grams. So we take into account the size of the brain, the time, and how many milligrams it's absorbing. Within the first 24 hours, it has dropped to about half of its capacity to function and never corrects over the time, and it keeps going over time. We have people who are not getting enough metabolism of the brain. The brain actually uses more glucose the more active it is. It uses less glucose the less active it is. Here's Dr. Belinkie's statement. So fatigue selectively targets the highest order of cognitive, mental functioning. Critical thinking becomes impossible. Where do you do your critical thinking? In your frontal lobe. In the same lobe that you have perception and spiritual perception and moral values, and you go through the list. Sleep-deprived people are a whole lot like intoxicated people. They don't think straight. They do things morally that they would probably never do, and they take risk that isn't reasonable. Drowsy or drunk. Most employers would discharge an employee for showing up to work drunk, but won't even consider telling them to go home if they didn't get enough sleep. Which employee is more dangerous? If the one that drives the heister around that runs over 3 people, you would consider them both dangerous. The similarities between drowsy and being drunk makes one sit up and notice. One study of sleep deprivation documented restricting to 5 hours per night over 1 week period resulted in a level of cognitive impairment equivalent to 2 nights of total sleep deprivation. You can lose sleep, but it is progressive or cumulative. Once again, another military slide. Here we have a military operations. You're out on the firing field. You are told to hit the target as many times as possible. 4 groups. One group got 7 hours of sleep a night. One group got 6, 5, and 4. So obviously the first day, the guys that got 7 hours of sleep would have the least time on the firing range, and the guys who got 4 hours would have the most time on the firing range. And so they're out there firing away at the target, rounds per tube per day, okay? So we got 100, 200, 300, and 400 rounds or bullets. And so we find that the group that got 4 hours of sleep were out there for 20 hours, and they got about 400. The group with the circle, 5 hours, 4 hours, and 3 hours. But what I want to point out is at the end of 20 days, the group that had the highest score, look what happened, 4 hours a night, went from 400 in a matter of 3 days to less than about 280 to 200, and continued to decrease to where they were actually about 70, able to hit the target with 70 rounds in their 20-hour period. Not too good. Notice the second group, the 5 hour, the 6 hour, only the 7 hour group maintained. So we're starting to get close. We need to have an 8 and a 9 hour on here and actually see it going up. Now, I am not an advocate of war. I am not trying to promote it. I'm just trying to tell you why we have friendly fire. And we are learning from these studies that were done. Now, you probably aren't going to go out and get on the range and see how many bullets you can shoot. But it is an indication for how effective you are in your thinking, your physical skills, and your ability to see that. Pilots have a variety of tasks, and here we are looking at airplane pilots. We look at task, what's the requirement, and what's their capacity. So how good is your brain doing, and can you handle the job? The blue line here says margin of safety. The light blue is task requirements. The dark aqua is pilot capability. So pre-flight, you're sitting there, you're setting up your flight, you're setting up your plane, you're flipping all your switches, you're checking all your gauges, and so the safety of margin will be the difference between the requirement and your capacity. Obviously, you can see that the requirement is low compared to the pilot's capacity. Doing great. Very few accidents happen on pre-flight. You know why? You haven't gone anywhere yet. Isn't that great? Now, you're taxiing. The plane is moving, so we've got potential. The task, the requirement went up, but the pilot's capabilities also went up, almost to 100%. These pilots are awake and alive, okay? The margin of safety is slightly less because we've got, obviously, the plane is moving. At takeoff, we have the margin of safety gets less, the task requirement increased, and we hope that pilot is wide open, at least when he takes off. The cruise, the autopilot takes over. The margin of safety is still good. The task requirements are low, and so our margin of safety is still pretty good. I'm sorry, our margin of safety here is still good. Approach and landing, 80% of all accidents happen at the approach and landing. And of those accidents, most of them are due to pilot error, not the landing gear not going down, etc., etc. So look at the margin of safety. Extremely small. Less than 5%, maybe about a 3%, maybe a 4% margin of safety. We're running too close here, folks. The pilot capability, he's just flown that. The requirements and the capability are so close that we only have this much safety. The taxi, they've landed, they're successful, they are on the ground, and now they're driving the plane into the hangar. And so we see that the safety margin goes up, the task requirement goes down, and we've got a tired pilot on our hands that is only functioning at approximately 40%. Now, here's the scary part. In a study done on pilots and those microsleeps I was talking about, in a 2.5-hour flight with a pilot who slept less than 6 hours a night, I believe it was 6 hours, less than that, they had 84 microsleeps that they monitored on the flight. These guys are up there sleeping. Okay? The problem was that in the approach and landing, there was 64 microsleeps in a 2.5 hour. They had the pilots sleep for 7 or more hours. They still had microsleeps during the flight, but they had 0 on the approach and landing. That's why I pray for my pilot. According to the National Sleep Foundation, sleep deprivation and its effect on work performance may be costing the U.S. employers some $18 billion a year. Another study puts it over $100 billion, so you can have your estimate. The point is, it is costing the employer for being sleep deprived. The work absence of employees with insomnia costs an average of $3,000 per employee each year, while missed days of good sleepers cost an average of $1,200. So they do this data to find out who sleeps the best, who's the most sleep deprived, and just in it's in absences, it costs almost 3 times as much. I'm going to go past some of these because I want to get to some of the slides that I feel are more important. This one's talking about shift work sleep disorders. We touched on that. The most common symptoms of a shift work sleep deprivation problem are insomnia, obviously, and excessive sleepiness. Other symptoms are difficulty concentrating, headaches, and lack of energy. Guess what people walk in my office and one of the most common symptoms is? I'm tired. I'm worn out. I don't feel good. What's happening to me? Is it just old age? Am I getting old? And you're 35, and you go, no, you're not getting old because you're younger than I am, so that doesn't count. See, anybody that's younger than me is now, shouldn't be sick, see. I don't know how it's going to work out as years go on, but anyway. The point is that we don't want to admit that staying up to midnight and getting up at 6 is not an appropriate schedule. And you go, but you don't understand. My kids stay up late. Well, I do understand. My kids went to bed early. That's how I understand. But I didn't finish the rest of my story. My children went to bed at 7 o'clock at night, and here's the deal I made. You can get up anytime you want to. Well, isn't that fair? Sometimes they would be up at 5 o'clock in the morning playing in their room. Hey, that was part of the deal. If you've slept and you've rested and you wake up, you're great. Because I got up that time anyway, so it wasn't a problem, but it made me curious to find little noises happening in the room next door. You go in there and happy as a lark, they're rested and ready to go. Consequences of the shift work sleep deprivation: increased accidents, increased work-related errors. You've had those days when you had to do something mentally, and it took you 20 minutes to write this letter or this proposal or something, you're done. Next day you try to do it and it takes you 2 hours. What's the difference? Clogged up brain. Yeah. Increased irritability, mood problems. How do you like this one? HR issues. I always try to be nice to people that have to take complaints on the phone. First of all, there's no reason not to be nice. Being not nice to them, they're not even the one who made your product. Okay? They may know less about the product than you do. So being nice to them usually helps out their day because most people like to holler at them. And so really what that job is, they should call it venting, not customer service. Because most people want to get on there and have their beef, and you go, I didn't make it. Okay? But you can't tell them that because you're supposed to just catch the grief. So be kind to your customer service folks, okay? You'll get a lot more out of it. You may even make their day. You may even be their blessing. Okay. Does your work have drivers? Well, I don't want to take a lot of time with this, but the take-home message is that 63% of tired drivers turn to caffeine for relief. Only 22% pull off the road and rest when drowsy, as recommended by safety experts. How many of you pull off the road or get a hotel room when you're within a half hour of home because you're too tired and you shouldn't be driving? Have any of you ever done that? If you have, you'd be unique. You see, most accidents happen within 30 minutes of being home or 30 minutes from home. You've traveled all day and you know you can make it. I got another question for you. How many of you know when you're tired? You should. How many of you know the point at which you fall asleep? Thank you. You're being honest. There's a point where you know you're tired, but there is no way mentally that you know when you fall asleep. How many of you have woken up at the wheel and had your angels drive you're not sure how long? That's what's scary. That's what's really scary. I'm hoping you're so scared you pull over. I don't care if you're beside the road and roll your coat up in the form of a pillow and get some rest, because you should not be on that road and you just had your life spared, and I hope you're grateful. I don't want to talk about how many times that happened to me. Well, I don't want to start a whole nother area of this lecture. I want to go through and look at a few sleep deprivation glands, but this is the pineal gland. This is the gland that makes melatonin. I'm going to fast forward a little bit because I want to get to a few things. Melatonin is made in the retina and in the pineal gland. When the lights go out and you have less light input into the eye, that signals the brain to start making melatonin. Melatonin is a medication. No, it isn't. Melatonin is a hormone your body makes that causes you to be sedated. So, we can learn from that. This is just the chemical production of it. This is what causes it to not be protected. Non-steroidal anti-inflammatory drugs. What are those? Aspirin. How many doctors tell their patients to take aspirin? And we give them something to go to sleep then, right? This is your ibuprofen. This is your Tylenol. These are your non-steroidal anti-inflammatories. And they're used over the counter mostly. And you spend. Now, beta and calcium channel blockers. What are we talking about here? Blood pressure medications. Your beta blocker slows the heart, dilates vessels, and the calcium channel blockers actually cause the muscles in your arteries to relax, and therefore you make the artery bigger. Obviously, you lower the blood pressure. At least that's in theory. It works some of the time. But it causes a reduction in melatonin production. So these people are more likely to be sleep deprived. Anti-anxiety drugs and sleep aids. And that's what really gets me. You're in the hospital. You're resting peacefully. And it's the old joke. Then the nurse comes around and wakes you up to give you your sleeping med, you know. It's one of those kind of deals. This is the logic that we use. These anti-anxiety drugs and sleep aids to help you sleep actually decrease the very the very neurological process of your brain producing melatonin. You see, we ought to study from cause to effect. These things that seem to sedate you actually decrease your natural way of being sedated. B12. Now, 3 milligrams a day is a whopper dose. That's 3,000 micrograms. B12 is measured in micrograms, not milligrams. So people taking high-dose B12 suppresses or decreases melatonin production. To give you an idea, we talked last evening about B12, and you need somewhere between 1.5 and 3 micrograms. So 3 milligrams would be a 1,000-day dose, 1,000 days in one dose. So that's a 3-year dose in one dose. That's how high we're talking about here. And antidepressants actually don't work, okay? You talk to people who take an antidepressant, and I do this on a regular basis, are you less depressed? Well, not really, but I don't cry anymore. Well, I'm glad for that. And so what I found out is this. Antidepressants don't make you not depressed. They just make you not give a rip if you are depressed. That's really what an antidepressant does. Antidepressants make you not care if you're depressed anymore. So you don't care, so you're not going to cry about it because you don't care about it. Had this one lady that came in. She was taking antidepressants, and she said, last night my husband and I were watching this movie. And she goes, this is really strange. She goes, usually I'm the crybaby, and I start crying over these crazy movies. And she goes, last night I didn't cry at all. I looked over at my husband, and tears were running down his face. And she goes, you know what? I figured something out. I am so numb from this medication that I really can't handle it. So what was she coming to me for? For a creative way to get off her antidepressant. Because she goes, I can't handle it anymore. I'm just a numb zombie, and I don't like it. The drug makes me not depressed. It just makes me not give a rip. Lifestyle factors, stress, obviously, reduce the melatonin peak. And the melatonin peak is what you need to get off to a good rest. Stress, too much adrenaline, caffeine cuts melatonin production for half hours. But doc, I only drink 1 cup. Well, I'm sorry. That's 1 too much sleep. Alcohol, 41% reduction. Tobacco. Foods that help Rich in tryptophan, one of the precursors of the protein, precursor for melatonin. Whole milk, black-eyed peas, black walnuts, almond sesame, gluten flour, roasted pumpkin seeds, tofu. If you want to sleep well, foods high in melatonin, barley, bananas, tomatoes, ginger. You notice you don't see anything on here that isn't vegetarian, do you? Ginger, rice, corn, and oats. Why do you think horses sleep so well? What do we feed them? We feed them corn and oats as well as their straw and everything. Folks, it's really simple. If you've got a child who's hyperactive, feed them more corn and more oats. And corn, not as in sugar smack cereals, okay? Corn as in corn on the cob and that type of food. Oats as in oatmeal. And if you're a hyper person, some good advice right here. Foods high in B6. You need B6 to make your melatonin. Lima beans, lentils, walnuts, bananas, sunflower seeds, artichoke hearts, sweet bell peppers. They could be the green, the red, the yellow, whatever one you like. We're going to close on this slide because you're being very generous with your time, and we have a 2 o'clock appointment. But at the same time, I want to tell you, as I said this morning, that I will be glad to try to answer any question you have after that meeting or during that meeting. We can do it less formal. Sleep is worth far more before midnight. Getting 8 hours of sleep a night isn't just a matter of getting 8 hours of sleep in a night. Because if you're out of sequence with your normal circadian rhythm, you are not going to rest well. If you go to bed at midnight and wake up at 8 o'clock, you say, Doc, I got my 8 hours in. I'm saying, how do you feel? Well, so-so. I say, okay, what I want you to do is over the next 3 months, I want you to work your way back to where you can go to bed at 9 o'clock. And then they go to bed at 9 o'clock, and they wake up at 5, and they go, how you doing? Hey, my mind's pretty sharp. I can even read my Bible and remember what I read. 2 hours good sleep before 12 o'clock is worth more than 4 hours after 12 o'clock. If you are tight on your sleep, do not gyp yourself before midnight. If you really have to get up, go to bed at 9 and get up at 4. Your brain will love you for it. If you have to drive somewhere and you can make it, get your sleep first and then drive. Do not sleep while you're driving. It's never a good idea. Hours before midnight, this is a simple circadian rhythm scenario. That's all this is. You're actually starting to work with your brain versus against it. Now, can you train yourself differently? The answer is yes. And we call those night owls, or we call them whatever you want to call them. What I find out is when I treat them, if I can get them to sleep before they get their second wind, I've won. But if you wait till 10 o'clock and they start to get their second wind, they go, listen, I drag all day long. I finally feel good in the evening. I want to get something done. I finally can get something done. My brain clears up at 9:15, and then guess what happens? Midnight comes around really quick, doesn't it? So I have to catch them before they get their second wind. If you don't, you can't tell a person who's on a good, mental hiatus here that they are time to go to bed. So I say, if you wait till 11 o'clock and say go to bed, guess what? They tell me, listen, why go to bed at 11? I've tried it, Doc. I lay there for an hour and a half and I can't sleep, and I get so frustrated I can't sleep the rest of the night, and I wake up the next morning going, I don't care what that Collins guy says. He's wrong. It doesn't work for me. I'm saying, no, I'm not talking about Collins here anymore. I'm talking about your body. I'm talking about starting to get in line with your circadian rhythms. And somewhere along the line, you've messed up. A lot of us mess up in college. I used to almost envy those people who could go 20 hours and take 4 for sleeping and get up and go another 20. I could never do that. So my roommate, I had to get a roommate that would sleep about as long as I did. Now, we always got up at 5 o'clock in the morning, but we would even run a fan in our window to have the white noise, because I'm sure they had white noise machines back then. We ran a fan for our white noise, so we'd go to bed at 9, because, in a boys' dorm, it's all kinds of ruckus happens at all kinds of time. In fact, the end of the story, it does snow in Washington, D.C., and I was going to school at CUC at the time, and we wound up with snow in our room because we left the fan on. Now, some people may take pot shots and throw a few snowballs in, but the point was this was during the night. But we both slept in down sleeping bags, so we would have it cold and be able to sleep than to lose your sleep and wake up at 5 and you're ready to take the place apart. Mentally, you're better off sleeping and getting your mental work done. If you try to get your mental work done on a sleep-deprived brain, it usually is not effective. So those of you that are those who burn the midnight oil, as they call it, you actually are going to have to start to change. You go, no, I was born this way. No. You're not born that way. You're actually out of sequence with your physiology. The brain will change and will respond. So the take-home message is, number one, if you want to have the most attentive brain to make the best decisions so the Holy Spirit can talk to you through your mental capacities, you have to be rested. If you don't do it for yourself, if you don't do it for your job, at least do it for your God. That's the least that's required of us. Because, like I said, the decisions that you'll be making in the next year, in the next couple years, will get tighter and tighter and tighter. And some of you may even want to do the right thing, but your sleep-deprived brain will not allow you to do that. So this is actually a spiritual lecture. It may not sound too much like a sermon, but the point was, if you will do what I'm recommending here, you're going to help your pastor. Because you know what a pastor doesn't want to do? He doesn't want to prepare a sermon all week and come here and watch you snore. But we push ourselves so hard all week that we bring to God a smoked and pickled sacrifice. And what we should be doing is saying, God, if I am pushing myself so hard all week that I've got to come to your church to sleep, then why do we have pews? We should have beds here. And let you sleep from 9 to 11 and then get up and have a good sermon. Wouldn't that make sense? Might be a good community outreach. You may get more people here because they probably haven't slept either. But that's missing the whole point, isn't it? If we have pushed that hard during the week, that we have pushed God out of our schedule all week, why in the world do we expect to get the blessing He wants to pour out today? So if I've gotten on your back a little bit, praise the Lord. If I've stepped on your toes, hopefully they're not black and blue. But here's the point. Start asking God what the body wants, and the more you live within your body's framework, the way you and I are created, the better mind you're going to have. And you will never appreciate it until you work with people who don't have their mind anymore. And that's the hard part. I happen to work with both groups. I hope that I'm willing to take my own advice. And I don't care if you got your PhD in whatever level, if you don't take your own advice, it doesn't make anything. See, I have to take this to heart just like you do. I'm not exempted. Just because I know this stuff doesn't mean that I don't have to get my sleep. Anyway, I'm not sure how you close your Sabbath service. I got a man here looking at his songbook, so we're going to let him take over, and I'm going to sit down.